Let's hit it. And welcome to Alzheimer Speaks Radio. I'm your host, Lori La Beywith, and I'm so excited that you're joining us today. We are going to have a fascinating conversation as usual as we learn from people all around the world at all ages and stages of life. Stay tuned as we shift our dementia care from crisis to comfort. All right, here we go. What you think about, you will bring about. Well, hello, everyone, and welcome back to Alzheimer Speaks Radio. I'm thrilled that you're joining us today. We're going to have a really fun show. We're going to be talking about something I think we all need to learn more about, and that is how to be a good caregiver and provide great care while still maintaining self-care. And we have a wonderful, wonderful woman with us that will be sharing tons of information with us. But before I go there, I always like to welcome everyone to the show. I know not everybody is familiar with us. We're getting new listeners all the time. Our opening song, by the way, is called Clarion Call, and it's by the Mark Arneson Band featuring My Adore, and you can download that on any of your favorite platforms. For those of you that are new, Alzheimer Speaks is about sound news, not just sound bites. We want to have real conversations with real people. And so everyone is welcome on this show. If you're diagnosed, if you're a family or friend, somebody who cares or serves someone who is diagnosed with a form of dementia, advocates, researchers, and more. We've had authors, we've had singers and songwriters and movie directors. It is endless because we all play a part. We're all touched by this. And you can call in today. We're doing a live show and ask Roz or myself questions about caregiving. If you'd like, that number is 323-870-4602, 323-870-4602. And, of course, I want to thank all of our listeners. Your likes, your clicks, your shares, I hope you'll continue to do because you have really expanded our brand, and I so appreciate that. I really believe that, building community and providing comfort and knowledge is the way we are going to win the war against dementia. Now, we're coming to the end of October, but it is still Lewy Body Awareness Month. So, check them out. If you're dealing with Lewy Body disease, there is an organization specific for that. So just go ahead and Google Lewy Body. They'll come right up. And let's see, I want to mention a couple of our past shows. We just had a talk with one of the IBM researchers, and we talked about artificial intelligence, and they're doing some analysis of speech, short samples of speech, and also drawing. And it's kind of fascinating, and they're feeling that they might be able to predict way early on when they're seeing pattern changes in our cognition in the way that we communicate. We also had Val from Australia on, who is living with dementia, and had a wonderful conversation in her talking about what life is like. She had some great insights. We had Immune Bio and Amika on, a couple of research companies talking about non-invasive testing that they're doing. And we had the film producer and director of the film Determined on, which is wonderful, and that's going to be launching with some of the festivals and so forth coming up. I also want to give a shout out to the Memory Cafe directory. I love them to death. If you're looking for a way to connect, if you're living with dementia or caring for a person with dementia, these meetings are for you. Dave now has 5 different countries that he's tracking with memory cafes, and he also knows which ones are virtual. So go to memorycafedirectory.com to find out more about them. I also want to mention two that I'm involved with. One is Arthur's Memory Cafe. We meet virtually on the second and fourth Wednesday of every month at 1 o'clock Central Time, and anybody is welcome to join us, as well as Artist Senior Living in Woodbury has a memory cafe called the Artist Way Memory Cafe, and they meet the third Wednesday of each month from 1 to 2. And you're free to join that. Feel free to reach out to me. I'll get you more information on that. Also, MDVIP still has their health quiz out there, their brain health IQ test. That is very easy to take, and you can find that by going to alzheimerspeaks.com. It's on our homepage. Coro Health, CORO, is still allowing people to download free during COVID two of their music apps. One is Music First, the other is Face, so you're going to want to know about them. And then let's see, across the pond, the Vamoose Theater is having the Wednesday Wave from 3 p.m. October 14th. They started this through December 16th, and you can learn more about that by going to vamoosetheater.co.uk, and then just press on the tab Arts in Projects to learn more there. DAA, Dementia Action Alliance, is now offering some free online programs. One is targeted to for people who are living at home with dementia. The other is for assisted living. And you can go to daa.now.org for more information there. Last one I am going to give a shout out to is to Healing Moments for Alzheimer's. They are doing a Zoom presentation designed to open up minds and hearts in new ways to provoke thought by challenging, our culture. And you can find out more information by calling 608-748-4411, and that's extension 811. So last, I'm just going to let the Footbar Walker tell us about them, and we'll be right back.
Introducing the life-changing Footbar Walker.
I'm Peggy from Danville, Kentucky, and I'm 91 years old. The Footbar Walker revolutionized my care of George. The saving that I made from having to put him in a nursing home came to about $192,000. The Footbar Walker opens and closes just like a standard walker. The only thing that is different is the top bar and the foot bar. Does that ever make a difference?
Does someone you love use a walker? Do they struggle to get up from a seated position? Are you a caregiver dealing with physical pain and stress as you help your patient? The Footbar Walker was designed to assist not only the patient, but also the caregiver. Patients have more control standing up, and no lifting from the caregiver is required. See how it works at thefootbarwalker.com. That's thefootbarwalker.com. Peggy, would you recommend the Footbar Walker?
Do I ever? I would not be in the health that I'm in today at this age had it not been for the Footbar Walker.
Footbar Walker is a wonderful, wonderful tool to help people get their dignity back and their independence. So I highly recommend that. I also, before I introduce our guest, I have to give one more kind of shout out. We are going to be rolling out a new program, and we're just giving some teasers, and we want to know if you agree with this or not. Do you think it's important for everyone at every stage and every level to have access to the same dementia information? Well, we do, and we want to support you as well. So don't miss our huge announcement. It's going to be November 10th, just a little under 2 weeks away, and we're going to level the playing field when it comes to dementia like you haven't seen before. So let's get to our guest. I know you're waiting there with bated breath so that we can get this conversation rolling. Again, we're going to be talking about giving great care while maintaining self-care. And we're so lucky to have Rosalind Marshall-Jones, who is an author, a speaker, and the CEO of Jacksonville's Best Caregivers. And she also owns Roz Jones Enterprises. Roz teaches caregivers and their families how to navigate the complexity of caring while supporting their own needs as well as their loved ones, and learning to live and build a healthy foundation of how to care. So, Roz, welcome. I am just so excited to have you on the show today.
Thank you so much, Linda, Lori. I'm looking at my other friend's name, Linda, here. But, Lori, for allowing me to come in and speak with your community, I'm excited. I'm excited about hearing about your announcement in November, and I'm excited to give information.
Wonderful. Well, I always ask every guest one question first, and that is, have you been personally touched by dementia in your own family or circle of friends?
I have. Two of the clients that I'm taking care of now have the beginning stages of Alzheimer's, and then I also took care of a friend's husband for the last 5 years of his life. He had Alzheimer's and dementia.
Okay, wonderful. Why don't you tell us a little bit about why you created Jacksonville's Best Caregivers, and what do you actually do there, and how do people tap into your services?
Well, I fell in it by accident, totally by accident. I was at church one Sunday, and one of the elderly in our culture, we have the older women in the church are called the mothers. And one of the mothers came to me and said, "Hey, I'm having surgery. Can you go with me?" And, usually you respect your elders, and you said, "Well, yes, ma'am, but why me?" And she said, "Of course, my husband is dead. I don't have any children. My sister has stage 4 cancer, and I have no one who can advocate for me if something would happen." Okay, go in. The doctor said it's going to be a simple procedure. She'll be in and out in less than 2 or 3 hours, clipping, snipping some intestines, and, she'll be in the hospital overnight, maybe 2 days, and then she'll be home. Surgery began. The 2 hours passed. I didn't worry about it too much. I said, she's probably in recovery. We go into 4 or 5 hours. I said, she's still in recovery. Don't worry about it. But then when the doctor comes out, he still has on his beanie and his mask. Something is wrong. Okay? Yep. So he pulls the mask off and says, "Hey, Roz," and Miss Rose has given me permission to use her name freely. Miss Rose has had complications. We've had to cut out more than, so many inches and feet of her intestines because she had more blockage. She's going to be in the hospital longer than we thought. So we need your signature on this paperwork. Wait a minute, pump the brakes. I don't have power of attorney, healthcare surrogate. I have no authority to sign anything. My only response was, whatever the hospital says do, please do it.
Mm-hmm.
How many of us have tried to help? How many of us have tried to help people in whatever situation, thinking it was going to be a simple procedure? But now, just like with Miss Rose, her care went from 2 days of care into 2 weeks of care. Mm-hmm. And I had really no authority to say anything until she woke up and verbally gave permission for me to speak on her behalf.
Wow.
So the 2 days turned into 2 weeks, and while I was taking care of her, the nurses kept saying, "You're not related to her, but you're giving care to her like a family, like a nurse. Why don't you go down the street to this company, XYZ company, and they're looking for sitters." Went to the company and said, "Hey, I want to just inquire to see how much it would be to be a sitter." They said the hospital's looking for sitters. "Oh, yeah, we're looking for sitters." I said, "Well, how much do you pay?" They said minimum wage. I said, "Oh my God." I said, we have all this responsibility in our hands as a sitter, and you only want to pay minimum wage. And at the time, I was working for a major healthcare company I was, one step from the C-suite, making a good salary. Let's just say that. So what they were offering me, I probably made in the first 10 minutes of work. Let's just say that. Okay. Mm-hmm. So, my mind was like, "Are you serious? You want this kind of care and this kind of, mental, physical, emotional, work for this amount of money?" It blew my mind. However, something tapped me on my shoulder and said, "Do it." So I did.
Wow.
So, yeah. So I did it. And so I did it as private duty first, and then I fell into the business. And now 2 weeks, two days of work turned into 2 weeks, turned into a lifetime of a business. And Jacksonville's Best Caregivers came out of all of that.
Wow. Well, you know, I don't think anybody kind of walks into this graciously.
No.
It just kind of hits you on your backside, and you're kind of pushed through the door, and poof, you're there. And, you know, I think so often, you know, we do look at things really casual and, oh, sure, I can do that. And we don't look at bigger picture and ramifications. And, you know, I'm a big pusher now that every child who graduates should have power of attorney, healthcare directives, but we're not at that level. But that's really when all that stuff needs to be put in place, because anything can happen to any of us at any time. And, you know, people overlook that. You know, we all think we're invincible.
But you know what, Lori? I'm glad you brought that up about 18, because for those who don't know, many colleges are moving forward and making sure that all 18-year-olds have advanced directives when they enroll in school.
Mm-hmm.
So there are a lot of colleges now that are implementing advanced directives just because so much has changed now. And they're doing it because you have a lot of blended families, step parents, adopted parents. You have a lot of this going on, and you don't know who the parents are, or the legal guardian, or the caregiver is for this person. But I'm glad you brought that up, and I just wanted to put that out there for the parents of kids who are going to school. Yes, please get their advanced directives as soon as they walk on the campus. Before they get on campus, have them available.
I love that. I had not heard that. So to me, that is wonderful, wonderful news that they are changing that. I mean, it's sad that COVID had to be the one to make us realize that, but it is so critical, because I've had lots of parents say, you know, gosh, the doctors won't talk to me, and I'm paying for the health insurance. This is my kid.
Exactly.
You know. And
exactly.
Yeah.
There's already a level of frustration already, you know, trying to get your mom from the house to the doctor. Now you don't want to talk to me, but I'm paying the bill. I have, you know, there's a problem there, you know.
Yep. And when it comes to friends, it's such an easy thing to want to do, and none of us know what's going to happen, but it is something that we should all be asking up front. You know, do you have this stuff, you know, do you have your paperwork in order? And I know it's an uncomfortable conversation, but, you know, if it's like most things in life, if you're prepared for it, it won't happen. You know?
That's it. That's why they call them advanced directives.
Yep, exactly.
To plan in advance.
Yeah. Now, one of the things I wanted to talk to you about is during early diagnosis, you know, everybody, you know, when they get diagnosed, they're just overwhelmed. What do you think are some things that really need priority handling upon a chronic illness, you know, like dementia?
As soon, I hate to say this, as soon as you're diagnosed, of course, you have to get over the shock. You have to give the person time to absorb it. But, you know, once reality sets in, hopefully within 30 days after the diagnosis, then, you know, we need to just sit down and have a conversation. And we don't have to cover everything in that first conversation. However, we have to have at least one piece of paper in place. If nothing else, let's do the power of attorney. Even though I'm your wife, even though I'm your daughter, even though I'm your aunt, your cousin, whatever it is, let's get one document taken care of. So if something does happen, for whatever reason, and even though you're still cognitive and you're able to talk and you're able to make many of your decisions now, if something would happen where you couldn't talk, what would be your wishes? And so let's write those wishes down and put them on a legal document. Let's do that. Let's do that much.
Yep.
You know, if nothing else, so that you, if you're laying in the bed, I have peace of mind that, you know, Lori can handle my banking. Lori can handle my social media. Lori can handle Lori can handle everything, and I can recover knowing that when I do go home, everything is not in chaos because I didn't put the right plans in place.
Yep. And the other thing is, you know, for those people who are caring for someone with dementia, they better have their stuff in order too. Because what happens if something happens to you? Then who's going to care for your loved one? You know,
and that's it. You're exactly right. You got to have a plan of care to take care of them, and then if something happens to you, you still got to have a plan B to take care of them in case you're not around. So there's two things you have to talk about. There's and it's, you know, it used to be if neighbors and friends used to automatically take people in a long time ago. I used to see my grandparents do that, and neighbors. If someone died, well, you know, take her in. She doesn't have any family. Take him in. He doesn't have any. People don't do that anymore. People are so scared about the legal ramifications and everything else that comes along with what society has put a fear in now, you know, but they forget that we are our brother's keeper. Whatever we do, we are supposed to serve. That's a part of our mission, a part of our life, is that we are constant service. But have we forgotten the basics? Have we forgotten because of fear? Have we forgotten that we are supposed to serve? I'm sorry, I'm getting on a big soapboat here, Miss Lori.
No, I totally am right with you. I mean, I talk about all the time how, you know, when I was little, if I got hurt, I could knock on anybody's door on really almost a 4-block radius, and I could get a Band-Aid, I could go to the bathroom, or I could get a sandwich or a hug. You don't do that anymore. I mean, we don't know. A lot of it is we don't even know our neighbors anymore, let alone take them in. And then when you do know somebody, even like through church or something like that, you worry about the legal ramifications. And, you know, they don't have anybody, but there's a great niece that all of a sudden pops in the picture, or you know, someone who's estranged, you know, because family dynamics are really complicated. And I think even more so nowadays than they used to be. And everyone, you know, there's this sense of entitlement. And so, plus life is really, really busy and moving really, really fast. It takes a lot of time to care for somebody. And so, that definitely complicates it. I know, you know, one of the biggest complaints I hear from people is upon diagnosis when they go to the doctor that, you know, they get a prescription, they get another appointment, and as they're walking out the door, they're told, "Now get your affairs in order," which isn't too helpful and really overwhelms people. I think it has to be put in perspective too. I'm not telling you to do that because, you know, your diagnosis and your time is limited, because they really don't know on most any types of dementia how long you're going to live. I mean, no one believed my mom would live for 30 years, but she did.
Oh, exactly. The client that I took care of, he lived for 25 years. So medicine and technology has helped us learn a lot and give a better quality of life to all types of diagnosis of any disease. You know, but however, with us being able to give them a longer and better quality of life, do we have the things in place to support the caregiver and those connected to be able to support them for 2 and 3 decades? You know, now it used to be if you got a disease in less than 5 years, you would be gone. But now people aren't living like that. Do you have the stamina, the wherewithal, the support to be able to say, I can do this? You know, and particularly for husband and wife, because many of our older people, you know, that bow in sickness and in health is very serious. But in some cases, some people can't handle the sickness. Yep.
And that has to be looked at in a realistic fashion. Otherwise, it gets abusive. And, you know, nobody wants that. But we can't stretch people. Yeah, we can't stretch people past their comfort levels, and families, they're all over the country and all over the world now. So it's not, we just don't have the support systems in place, and we don't seem to have a comfort level especially in the U.S. of asking for help. We see that as a failure, and that has to change. That has to change, right? Because nobody does anything alone, and the more resources we have, the more comfortable we're going to feel, and the less stressed we're going to be, and the better care we're going to give. I mean, that just makes sense.
And you don't want your care to turn into bitterness. And then also, too, as a society, when something goes wrong, or if it's a failure, it's almost like a black mark on our character, on our integrity. But failure is not always that. We don't have a playbook for life.
Mm-hmm.
We don't have SOP. We don't have SOPs for life. So how can we put so much weight on failure? And it's not fair to the caregiver. It's not fair to anybody in any part of your life, but particularly in caregiving. There is no handbook for this.
Mm-hmm.
You have to a lot of times go by gut, or again, like you said, ask for help, or get the right documentation in place to make sure that as we can cover as much as we can.
Yep. It is just critical. And again, you have to maintain a healthy self to care for somebody else. And
Mm-hmm.
I know on my journey, I did not really understand that. I just kept taking more on and more on and more on, and I didn't give up any of my other roles. And then I wondered why I was exhausted, and even when I was so tired, I couldn't sleep because my mind was thinking of all these other things that I had to do. And you've got to get your rest, and you've got to keep your social connections, fast and in place. And you need access to be able to find different resources that are out there. But, we were talking offline before we went live about, you don't know, people don't know what they don't know. So they don't even know what to ask for. And so that's, again, another reason we have to have these conversations, with our family, with our friends, because we all have different wells of knowledge, and we can share that. But, it's just stuff people don't think of all the time. Sometimes it's a matter of, when I used to sell real estate, I would do a lot of classes, all different types of classes. And I said, you know what, you might not use this for yourself. You might end up using the information you're learning here and giving it to a friend who's going through this. You might not be ready to make that move yet. You might not be ready for that change of life, but you're preparing, you're getting knowledgeable, which is all good and healthy things to do. And then again, you're this well of information for others. And I think sometimes we don't look at gaining knowledge in that realm, that it's good to be prepared. It doesn't have to be a paranoid thing. It's just good to know what your options are and when you're going to need them. And, again, when it comes to, getting your papers in order with the healthcare directives and powers of attorney, that's not about end of life, but that's what it's attached to. That's what people think it's about. It's about smart living. Because any of us could get in a car accident or take a fall and all of a sudden be in a predicament where we need to be in the hospital, and maybe we're incapacitated or disabled for a while, and we need help, and we need to know what the plan is, because it's never a good time to make a plan when you're stressed.
That's it. And the thing I don't understand is that we could plan for our children's education, get all that documentation ready. We could plan for, our 401ks, for a wedding, for a vacation. We get all that paperwork ready. We can, plan to go get a pedicure, a manicure. We can have all this stuff ready. But we can't plan for the most important time of our life, which is, the end part. And so to take that stress not only off of you, but then the people that's caring for you. Well, what do you want to do? I don't know. I don't know is not an answer, right?
Yep.
and these times, I don't know is not an answer, or I don't want to talk about it is no longer an answer, because I have seen if you don't make a decision, you can become a ward of the state. The state can take over and make the decisions for you. If or the court, you can be assigned a guardian.
Yep.
And you don't want that to happen. You do not want to be assigned a court appointed attorney guardian to get into your business. Trust me.
Mm-hmm.
Because the court and the guardian and that attorney will get their money first before any family does. So I just wanted to put that out there.
No, that's good. Where do you find is the best place for people to find resources for documents?
There are numerous places where you can go. There's a place called Legal Aid for those who are on a fixed income.
Mm-hmm.
Legal Aid is all across the United States, and that's one of the places where you can get have someone to prepare your documentation for you if you are on a fixed income. Now, Legal Aid will also do it if you're not on a fixed income, but realize there may be a small fee if you are above their income requirements. They won't turn you away, but they will let you know that, hey, this is the amount that you will have to pay. Also, too, you can check with your state's pro bono area. Each state has, the Bar Association, and then they have, what's called pro bono.
Mm-hmm.
And there are so many hours that attorneys have to give back voluntarily.
Mm-hmm.
So with that, you could check with the pro bono part of your bar association for your state, for your local state. But also too, you can check with Legal Aid as well for those advanced directives. Pro bono attorneys that wouldn't mind helping you get those documents in order.
Mm-hmm.
And so, those are two of the places. Then also, too, you have hospice. They have what's called the 5 Wishes.
Mm-hmm.
And they have a document that you can also use to that will guide you through the process as well. AARP also has information on advanced directives. Some of this stuff you can do on your own. If you feel comfortable. If not, then go through Legal Aid, and they will guide you through the necessary resources. Also, to your local AARP, Council on Aging, Aging True, Aging Well. There are a lot of resources out there, and I will email that information to you so that you can give it to your viewers. So that they will have it. But there are many resources out there where you can do it for free. But if you're not comfortable with doing it for free, there are attorneys that specialize in elder care. So you can also go to your local bar association and see who specifically deals with elder care. Because if you have, let's say, if you have assets over $250,000, you may want to look at putting your home and some other things in a trust, because if you have to go into a nursing home, they look at the last 5 years of your bank statements and of your assets, and if it was not protected by the trust, or if it's not in the trust, they will dwindle down your money before Medicare and Medicaid will kick in to start paying for a facility. So you want to really be knowledgeable, and every state has different rules. Let me say this again. Every state has their own laws and bylaws and rules and whatever the case may be. But, look, and if you're going to look into putting into a trust, please seek legal advice.
Yep, for sure. I had somebody on, Catherine Hodder, who was, she's an attorney, and she wrote this great book on estate planning. And it's called Estate Planning for the Sandwich Generation. And what I love about it, you can go back and listen to this show, but she also has examples of what she calls My Family Binder. And it has all of these great form letters and information to fill out. And you can buy them separately, or you can buy the package, I think, for like $50 or something, which is well worth it. And yeah, it's a great book. But if you go to Alzheimer Speaks and just look up that show, it wasn't all that long ago. I think it was the end of September and beginning of October. And really, really good resources. Now, it looks like we've got somebody on the line, so I'm just going to pull them in and see if there's a question. The last of the number is 7620. You're live and on the air. If you won't mind stating your name and if you've got a question or comment for us. 7620, are you there? Well, sometimes just people call in to listen to the show this way too, so it might be that. Okay. So we'll just keep plugging along. But I always like to reach out. Sometimes people get shy, think they're going to ask a question, and think, well, maybe
that's okay.
Maybe not. How should people approach the conversation of care itself in terms of maybe asking for some help, or even identifying someone else who needs help? Do you have any suggestions for our listeners on that?
For the person that is giving the help and recognizing that maybe their parents or loved one may need it, some of the warning signs that we may overlook are bills not being paid, grass not being cut, a lot of food in the refrigerator that hasn't been thrown away, the house not being as tidy as it used to be, a lot of overdrafts on the bank account, because what's happening is spam callers are calling in and asking or scaring this senior person that may have, dementia or Alzheimer's, scaring them and saying, hey, this bill is not paid. I need your credit card information. I need your banking information. And that's where, those are the warning signs that let you know that, your mother, your parents, your aunt, uncle, whoever it may be, cousin, may need some help. So a lot of times you can tell by what's going on in the finances, what's going on, at the house. Is the mail piling up in the mailbox because they're forgetting to go out and check the mail? Or overdue notices coming in. So that's a small sign that, they need help. And a lot of times when food is in the refrigerator is because the person who does have this disease, they're scared to handle the heavy pots. They're scared to handle the microwave because they turn it on and forget, and the food explodes, or they may put the wrong time on the food, and, now the microwave is ruined, or, the food, they forgot about the food and the pot burned up. So, these are just some small, warning signs. I tell people, not Google, the Word document, that little red line comes under there, that's a warning. And so these are the same type of warnings that, that we have when someone needs care. Now, how do you approach it? You have to have a conversation. Hey, I'm noticing some things around here. Would you like my help? Or, can I get one of your neighbors to come in and help you? Someone that they're familiar with. Or are you willing, for me to, ask someone to come in and to clean for you, to get them, even though they're in their house, they still want to feel independent and that they've made the choice to ask for help. And so you have to approach it in a way to where it that it's allowing that person to say, okay, I do need help. I didn't see this. I'm glad you brought it to my attention. Let's sit down and talk about it.
Mm-hmm.
Also too, as we are getting, older, we have to sit down and just have the conversation during the holidays. This is a good time. COVID has put us in a whole nother mindset. So if you have to use COVID and use COVID, if you go in the hospital, I can't come in with you. I have to be able to make decisions. If I can't make those decisions, the hospital will make them without your blessing and without me being able to say yes or no. Do you want that to happen? So COVID can catapult you into that conversation that you couldn't have had before, but now you can have it because everybody knows that once you go in the hospital, your loved one can't come in the hospital with you.
Yep. And that's so critically important. And like you said, COVID evens the playing field, so it says anybody is vulnerable, and
exactly.
So that's a kind of a strange gift COVID's given us, but it is opening up the door to different conversations and how we look at things. So thank you. Those are great information. What about the progression, of dementia? What types of things do you think people should consider in terms of, again, their wishes, their life support, even where they live, if things would have to change in the future? When do you think those types of things should be addressed, or is it something that you're urging them to get their paperwork in order, it's done, and then it's reviewed on a regular basis?
I always suggest that they review every 6 months, and not only review the advance directives, but particularly the insurance policies. Because what happens is people fail to forget that a lot of companies are merging now or going out of business because of COVID. And so insurance companies are buying other insurance companies. And in January, you could have been insurance company ABC, and then by July, you could be insurance company merged with XYZ, and you don't know that. So are my benefits the same? Do we get the same burial benefits? Do we get the same payout? Do we get the same payout within a certain amount of days? So I suggest that you check with the insurance company every 6 months to make sure, and then get a printout of the insurance policy every year. Request a copy to make sure that everybody's on the same page. So far as the progression of the disease, talk about it now before they can't talk about it. Talk about it now before it gets to a point where you can't talk. Because when you can't talk, it's not the time to ask them, okay, we need to go to the bank to sign your documents. It's too late then, because the bank is not going to allow them to come in and sign, and they're not cognitive. All this needs to be planned in, and that's why they call them advance directives, in advance. Because you need to say, okay, you can talk now, but if you can't talk, or if you get to the point where you cannot walk and I cannot handle you in the house or at your house, then I go ahead and make plans to put you into a facility where you can get the care that I can no longer give you.
Yeah.
This is real. It's realistic. It's real.
Yeah. And, some of our listeners might be thinking, well, how does that help my self-care? But it does. When you have answers, when you have directions, when you've had those conversations, you're not worrying about what did they want. You're not carrying that guilt, that angst. That's huge. And you can live a much more comfortable life. And you can do this right alongside them. So it's not just them doing it alone. I think some of the other things in terms of, wishes and life support, in maybe a community that you want to live in, is also getting down to, what's your bucket list? What haven't you done that you want to do? What brings you joy? Maybe making a playlist of your music that you like. Friends. Who's your real key circle of friends? I mean, we all have friends that are close and might want to be with us during certain times of our life, but we might not want them there. We could tell somebody that so that it's comfortable.
And ask the question, how do you want to live? How do you want to live if this happens? How do you want to live if you're not able to walk? How do you want to live in the last 6 months of your life? Do you want to stay at home and die at home? Or if you're in a facility, how do you want to, how do you want to live? And that is a question, that you need to talk about. You need to let them know about hospice. Just because you're on hospice doesn't mean you're going to die in the next 6 months. I've had somebody on that was on hospice for 7 years. Hospice has different programs now versus what they used to have. They have programs where you can be on there for a longer period of time. So don't look at it as, okay, I'm getting ready to die in 30 days because I'm on hospice. No, hospice sometimes can give you care that your home health care cannot do, so far as pain management, so far as having a nurse coming in every month, every 2 weeks, as the disease, declines and the person declines. Hospice can come in, and they will come in more, on a regular basis as the patient declines. So, talking about how you want to be cared for is very important. It's very important. Even what direction, I'm gonna say this. When you go to the airport, you want to know where your airline is, because if you don't know which way you're going, it's stressful being in the airport and not knowing which gate to go. That same stress is on your family, because they don't know what plane to put you on. They don't know, because you haven't given them the ticket to put you on, on the flight that you want to go on.
Yep, that's very true. The other thing I think is, looking at what you have and who do you want to pass it on to? Because if you're not using it right now, give it while you're alive so that you can see the joy of the person that you love having that and receiving that. And, so there's lots of different things to do. I think, self-care is important for both the person with dementia as well as the care partner. And one of the things that I didn't realize I was doing, and my listeners have heard this before from me, but I would get mad at my brothers for not caring the way I cared, not being as involved and as I thought they should be. And one day we had a conversation, my brothers and I, and they're like, well, you're kind of a control freak. And I'm like, well, no, I'm organized. We saw this big difference. And through that conversation, I said, I'll take some of the blame, but I'm not going to take it all. You guys didn't really want to show up because of the emotional baggage that you'd have to process, seeing the change in mom or dad. And so, we dug a little bit deeper, and I kind of had to chuckle thinking, gosh, I guess I was, and I didn't know it, I was putting out, you do it my way or the highway type thing. And I realized, and I joke about it till this day, that, nobody wants to be stuck with me 24/7, no matter how great I think I am. Nobody wants to be tied to one person. We all need other outlets. And so does the person with dementia, and so does the person who's caring for them. And they have a right to have those other entities in their life as long as they're not causing any harm. They might not be just like you, but, diversity is really, one of the great gifts of life, that we're not all the same. We're not a Stepford family that all walks and talks and looks and does everything just perfect and right. Somebody might have a personality who's very compassionate and consoling. You know, somebody might be a little bit more abrasive, but maybe they're the comedian in the family. I mean, everybody has different skill sets, and we should really look at not taking that away. And sometimes, like in my case, that wasn't even on my radar to look for. But, you know, after the fact, when we had that conversation, I could see it blatantly. But again, it was also an easy excuse for my brothers not to be involved, because they could have brought it up earlier, but they chose not to. So again, it gets into having authentic conversations. And for me, you know, we were talking about stories, and I had all these great stories about caring for. My dad had brain cancer. My mom had dementia. So I had all these wonderful stories. And I remember my older brother looking at me going, well, where'd you get all these stories? And I'm like, well, I was there. And then my heart just sunk thinking, oh my gosh, they don't have any of these. And I went from mad to sad for them. You know, mad that they weren't stepping up. Because then I also realized, and this is a good piece of self-care too, once I stopped trying to fix them and make them like me.
Okay.
Oh my gosh. I must have lost 1,000 pounds that I was carrying on my shoulders. I mean, I felt so much lighter, and I had more time and energy to devote to who I was caring for, instead of trying to fix somebody who, you know, in my eyes didn't want to be fixed. You know, they thought they were perfectly fine, and they were. You know, they're their own person, and you know we have to allow people to be their own people. I think but we do need to step in if there's some abuse or neglect or something like that is happening, and not stand back. So I think this has just been a really fascinating conversation. I think we've covered actually a lot of ground. Are there other things kind of for self-care that you think would help both a care partner and a person with dementia, things that they should keep in mind for themselves?
Yeah, their favorite word should be no. No. Yeah. Well, it is funny. Yeah, go ahead.
It is funny because we tend to think when we're in that role that we can't say no. And boundaries are really healthy. And, no is a valid word, and it's okay. And, it might hurt the other person that you're saying no, but sometimes we have to look at how much is this going to hurt us to take this on. What is this What is this doing to us on all different levels? And that's something we don't teach as well as we should.
Exactly. So, the word no, and you have to stick by that, because, again, like you said, boundaries. And so also, too, even with the end of life care, you have to say, no, I can't do this. No, I'm not physically able to do this. Because think about it now, if your parents are in their 80s or 90s, then you should be somewhere between, maybe anywhere between 50 and 70. How much physically can you handle? Yep. And if you have a disease or a disability, that means you can't take care of your parents. So, there's a lot of things you have to look at, so far as what you can physically do, emotionally do, and if you can't do it, I tell people this all the time. I would rather for them to go into an assisted living facility than for you to take care of someone and become bitter and abusive.
Yeah, or hurt. You can physically get hurt. And, there's a lot of care partners that pass away or become incapacitated way before the person they're caring for. And so, exactly. we've got to be conscious of that. Well, Roz, this really has been a fun conversation. I'm so glad we had the opportunity to chat. I love what you're doing out there, and the attitude and your approach is very realistic. And, don't underestimate the importance of paperwork. I know none of us really like it, but it's about smart living. It's not an end of life thing. it really, it got thrown in as end of life, but it really is about making sure your wishes and your life is completed the way you want. And so don't underestimate the importance of that, not only for yourself, but for those who care for you, because there's a lot of guilt and a lot of angst of, are they doing the right thing? And it's just so much easier to have the conversation. It really is. And that can be a two-way conversation. It doesn't all have to be about one person. These are big picture items, and everybody has an opinion of what's best for them, and it'll be different from one person to another, and that's okay. That's why we gotta ask. That's why we gotta have the conversation, is because it isn't a cookie cutter thing.
It's not. Not everybody has their own individual thoughts and plans on how they want to live their last days.
Exactly. Now, people can get a hold of you at your website, the caregivercafe.net, caregivercaf.net, and they can also email you at assistrozjones@gmail.com. And then you also have a Facebook page under Jacksonville's Best Caregivers.
Jacksonville's Best Caregivers. And also my YouTube page, where I give a plethora of videos, of videos on documentation. Right now I'm doing a series on, of course, this Medicare open enrollment from October 15th through December the 7th, which is very important that you look at your documentation this year. Every year is important, but this year you really, really, really need to pay attention, particularly if you have, medicine, or if you want to go from original Medicare to, Medicare, Advantage using another plan. You need to sit down and really compare, and the reason why I say medications is because, you may be on more medicine this year than you were last year. And so you may want to change part of your plan because you have a greater need for medicine and it's costing more. So how can I reduce that? So those are my little small tidbit so far as for Medicare. Some of the things that I talk about in our series for Medicare, and then I'm also doing Medicare trivia, which people are really loving on the YouTube channel called Jacksonville's Best Caregivers.
Okay, I was just going to ask you what the channel was. So it's Jacksonville, plural, Best Caregivers. Wonderful. Yep. Well, thank you again for being a guest on our show. Really appreciate everything that you're doing. And again, people can reach out to you. They can go to your website, thecaregivercafe.net, or email Roz at assistrozjones @gmail.com, or follow her on Facebook, and also her YouTube channel at Jacksonville's Best Caregivers. Thanks, everyone. Have a blessed week, and we'll talk to y'all soon. You can always reach me at alzheimersspeaks.com. Bye now.
Hi, I'm Lori La Beywith, and I wanted to tell you about Alzheimer Speaks, which is another great podcast. You see, my own mother lived with dementia for 30 years, and I felt lost. Did you know every 3 seconds someone in the world is being diagnosed with dementia? Odds are it's going to hit your families too. We want to help you connect to services, products, tools, research, and stories so you can be prepared. Please subscribe to Alzheimer Speaks on your favorite podcast platform.